May is Anxiety Awareness Month.
Which, by the way, is exactly the reason I created my maximum stress support from phoenixvitamins.com.
Yeah.
It's a fantastic way to address your central nervous system and anxiety thereof.
And I just think it's funny that there's only 1 month, considering, how many people and how many kids are all on these antidepressants and all this stuff. I think it should be anti-anxiety. I think it should just be anxiety year.
Exactly. It is the most epidemic problem. And it's virtually all human-made.
Yeah.
We have created a life and a lifestyle that is so incredibly unnatural to our natural rhythm of way of living that virtually everyone at all ages suffers from some form of anxiety.
Yeah. And it's so universal. What do you think is causing this, the unnatural way we live, the 9 to 5, the not enough time with the kids, the not enough quality time with the loved ones because of the work and the daily grind and the jobs? Talk about the different approaches, like maximum stress support from phoenixvitamins.com and or the drug approach.
Well, again, anti-anxiety medications are the number one prescribed medications worldwide, but especially here in the U.S.
Yeah.
Now, there are several reasons. You can't burn the candle at both ends forever. You can't run on no sleep. You can't work 2 jobs. You can't try to raise a family. You can't try to manage a household. You just can't. And nowadays, it is impossible. It's virtually impossible to do those things without a 2-person income because of the way the cost of things is. So that means both parents are gone, oftentimes on different schedules, and that leaves children unattended or attended by someone other than a parent, and that can create anxiety in even small children. So medicine's response, and oftentimes necessary response, is the use of anti-anxiety medications, and there are several groups of those. There are SSRIs, which are antidepressants, and they can have some effect on anxiety, but the most direct group of drugs directly addressing anxiety itself are the benzodiazepines. Those would include Xanax, Valium, and a few others. And they're extremely effective. However, as I have often said on many subjects, there's a price to pay for success. There's a price to pay for that benefit. They work like a charm, almost with the first one you take.
Yeah.
But they're highly addictive, highly habit forming. And because of that, if you have to take them for any length of time in any significant dose, you may find when you're ready to get rid of those things because you're doing so much better, you may find it extremely difficult to stop taking them because of what's called the rebound effect from your central nervous system.
No.
And so should those drugs be used? Absolutely. I mean, if you're on the verge of going completely mad with anxiety and stress, you need something aggressive to sort you out, at least for the short term. But the goal should be to take them as infrequently as possible for the shortest period of time. Then we begin to look at natural.
Well, let's switch gears totally and talk about what makes up an ideal stress formula.
Well, first and foremost, we would use high amounts of the B complex, especially B6, B2, and B12. B12
Such a
is
simple
the nerve
such
vitamin.
simple advice.
Well, yeah, and then when you combine that with herbal extracts such as kava, valerian, and those types of things, magnolia, you can get a pretty good natural anti-anxiety formula. And the good thing about that, because all of the things that are included in a good formula such as that are water soluble, which means that it's almost impossible to overdose on them. It is possible, because it's possible to take too much of anything, but it's difficult because they're water soluble and they flush out of the body in a relatively short period of time, usually 48 hours or so. And which is, on the other flip side, why we tell people to always take your supplements regularly, not just when you remember, not just some weird thing you read on the internet, heaven forbid. Take it every other day. Take it once a week. Here's the deal, folks. When you start taking a supplement program and you take that your supplement with your breakfast, that's going to be gone in 2 or 3 days maximum, maybe as soon as 24 hours.
Yeah.
So why would you take it once or twice a week? Then you've got all of that time in between where your body does not have access to those essential nutrients, and you ride yourself a roller coaster. High nutrients, no nutrients. High nutrients, no nutrients. And what do you think that does to your body chemistry? Oh, it's not always happy.
Yeah.
So, and it's a funny thing
You got to
that
be
I've
consistent.
noticed.
You got to be consistent.
Well, and I've noticed a funny thing about human nature. If your doctor recommends a drug to you, 9 times out of 10, you're going to take it exactly as it says on the bottle. For several reasons.
Well, because you want to listen to his advice.
Well, but not only that, but you want to get results.
Yeah.
From whatever you're taking it for. Secondly, because what you're often taking these things for is to management, treatment, or prevention of some disease. And you're afraid not to take it. But funny enough, you recommend to that same person to take for an example, in this case, a really good high-potency stress support formula, and all of a sudden, they'll take it once or twice a week because they treat it differently because it's not a drug from their doctor. What they don't realize is it oftentimes is more effective or as effective and a whole lot safer. And so it should be treated just like you're taking your medication. Take it as recommended.
Yeah. So all the other things people can do to manage stress, obviously spend more time with loved ones, pet your dog for the oxytocin, spend more time in nature, walk barefoot, all those things, meditation, prayer, all those things are always at top of mind and top of list. But if you do feel like you want to take a natural approach and you've talked to your doctor about stress supportive nutrients and your doctor thinks it's okay, a great place to look at is on phoenixvitamins.com at the maximum stress support. You can always start with just one bottle. You probably wouldn't recommend just getting one bottle because you like to see especially if someone's been nutrient depleted for so long, you would always say to do a couple months or, at least 3 months and 4 months.
Yeah, you have to remember that nutrients don't work like drugs.
Yeah.
Because drugs override the natural system. Nutrients support the natural functions of your body chemistry. And I always tell people, you need to take whatever you're taking and whatever you want to take for whatever reason. You need to take it at least a minimum of 3 months.
Yeah.
And you need to take it right, consistently, daily.
Regularly, daily.
Because the body does not reverse its chemistry with a snap of a finger. That's what drugs do. But drugs have a price to pay, as we talked about. There's a price for that instant magic.
Yeah.
Withdrawal, dependency, side effects. There's always a price. With nutrients, there's virtually no side effects and no price to pay except time.
Yeah.
And I always tell people, you got to give it at least 3 months. 6 months is better.